So in a minute, we are about to go live and then we will start. Before we go live, I'll let you know. With all your due permission, sir, we are live. Can we begin?
No.
Thank you so much, sir. Good afternoon, everyone. This is Batul from IGCP, and I would like to welcome all the viewers who have joined our platform for the better exchange of knowledge that is going to be shared by our keynote speaker, doctor, for today's session. Well, he needs no introduction. He is a very renowned venerologist at our platform, and he is none other than the very eminent Dr. M. Balasubramanian, sir. Sir is MD, DV, graduated and postgraduated from Madras Medical College, former state secretary, president and national vice president of IMA, founder secretary and past chairman of Professional Protection Scheme of IMA Tamil Nadu. With Sir's wonderful insights and with Sir's experience, we are going to talk about today's topic, which is CMV infection, diagnosis and management in HIV infection. So, before moving on to today's session, let us have a brief look on what the topic says. Diagnosis and management in HIV infection, diagnosing and managing CMV. Infection in individuals with HIV represents a significant challenge in immunocompromised patients. We'll be exploring the intricacies of diagnosing and effectively managing CMV infection in the context of HIV, highlighting the importance of vigilant monitoring and antiretroviral therapy and targeted antiviral treatments to improve patient outcomes and overall health in this vulnerable population. So, now without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him for his precious talk to begin. Sir, welcome at our forum. Over to you.
Thank you. At the outset, let me apologize for my bad throat. 2 days back, it was still worse. I was doubting very much whether I could participate and speak with you. Today is little better. Kindly bear with me. The topic chosen this month is cytomegalovirus infection, diagnosis and management in HIV infection. See, what is cytomegalovirus? Cytomegalovirus is a common virus. Over half of the adult in US have it in their body by the age of 40. How many of us will realize this? We think US is advanced, people are advanced, we think. So, but cytomegalovirus is common there in more than 50% of the people by the age of 40. CMV spreads easily through an infected person's saliva or other body fluids, especially during kissing and the exchange of body fluids during sex, it spreads. It is related to herpes virus, which gives the oral herpetic ulcers. So, cytomegalovirus is also called HHV5 type 5, human herpes virus type 5. If a person have a healthy immune system that can easily control the virus, it usually does not cause problems. Otherwise, people in US would have raised hue and cry, but many of them, since they have a good immune system, they do not have, it is almost asymptomatic in them. But it can make people who have weakened immune systems very sick, especially infections like HIV. In people who have advanced HIV, CMV can cause an eye infection called retinitis that may lead to blindness. CMV retinitis can lead to blindness. CMV retinitis is what known as age-defining conditions. It is seldom seen in other people, even though they are CMV positive. Unless until they have HIV, they may not have eye complication. The virus could also affect the intestines, esophagus, lungs, brain, or nerves. So, almost all the parts in the body can be affected by cytomegalovirus. There are different types of cytomegalovirus infection. Congenital. This is when a baby gets CMV from its mother before birth. So this is called congenital, from mother to fetus before delivery. Primary, this is the first time someone gets cytomegalovirus infection. It usually does not cause symptoms, but some people have signs that look like in mononucleosis, infectious mononucleosis. Reactivation. Third one is reactivation. An infection that has been dormant can become active again when the patient's immune system is weakened. Only a person might have had CME earlier, and when it gets HIV infection also, and then as such HIV infection advances, the CME get reactivated. It can happen if the person has advanced HIV or in treatment for cancer or other organ transplant, where they are given immunosuppressive drugs. So this is the diagram of cytomegalovirus. As its name suggests, it is larger, one of the largest viruses infecting the human body, and it belongs to the group of herpes groups. Cytomegalovirus symptoms. General symptoms of primary CMV. First, we will take up primary cytomegalovirus virus infection. Most healthy people who get CMV do not know it. They may kiss a person who is infected. They may get the disease, but they do not know that they have got the disease. If the patient have symptoms of primary CMV, they are mild but include fatigue, swollen glands, fever, sore throat, and muscle aches. Especially when they indulge in competition of kissing, who is kissing for a longer time, where the exchange of saliva may be larger in amount. So these people may get the uh, signs like fatigue, swollen glands, fever, sore throat, muscle aches. Less common symptoms of primary cytomegalovirus infection are rare but include changes to your personality, headaches, trouble in concentrating, shortness of breath, and dry cough. Symptoms of congenital cytomegalovirus infection. Babies born with cytomegalovirus might have premature delivery, small size or low birth weight, bluish like rashes, yellow skin or eyes, that is jaundice, swollen liver and spleen, small head, microcephaly, seizure, hearing loss, pneumonia, liver inflammation, that is hepatitis. So in India and African countries, we come across many of the congenital cytomegalovirus, especially premature delivery, low birth weight, a small head, microcephaly. We have seen. Symptoms of cytomegalovirus with HIV. If the patient also have advanced HIV, CMV can affect different parts of his or her body. The patient could have blind spots or moving black spots, floaters in the eyesight, blurry vision, blindness, diarrhea, belly pain, trouble swallowing, trouble in swallowing or painful swallowing because of ulcers in the mouth or esophagus, confusion, lower back pain, weight loss, fatigue, weakness in the legs. If the patient have HIV, you probably won't get sick with CMV unless his or her CD4 count and type of blood vessels is below 100. Normally it will be 750 to 900, and as it falls below 400, the patient will develop signs and symptoms. And when the CD4 falls below 100, cytomegalovirus infection signs and symptoms occur, that too in the eyes. Cytomegalovirus causes and transmission. People probably won't catch cytomegalovirus from casual contact, but the person can get it by touching eyes, nose, or mouth after having contact with an infected person's saliva, semen, vaginal fluids, blood, urine, breast milk. The person can also get cytomegalovirus through sexual contact, blood transfusion, and organ transplants. CME spreads easily in places with lots of young children, like daycare centers or anyone who spends time there at higher risk of getting it. There are also more likely to get virus if the immune system is weakened because of medication or another health condition. So, how to diagnose health and what are the tests and diagnosis? Blood and urine tests are available. These include cytomegalovirus antigen, a virus culture, or PCR. So, we can use ELISA method or PCR and or do a virus culture also and demonstrate the antigen. Serological tests look like things immune system makes to fight CMV called IgM and IgG antibodies, although most healthy people also have them. So if they have IgM, say CMV, it shows active acquired cytomegalovirus. If IgG is there, it might have been passed on to the fetus during uh, pregnancy or delivery, and the patient may not have signs and symptoms. We can also do a biopsy, which takes a small sample of tissue from the intestine, esophagus, or lung and look it under a microscope. Eye tests are used to check the inflammation in the retina. Imaging tests like CT scan to look at the changes in the lungs or brain. So usually we use PCR or ELISA or IgM, IgG. The treatment of cytomegalovirus is when the patient have retinitis because of cytomegalovirus, doctor may give strong medication that is intravenously for a couple of weeks. Usually we give 3 to 4 weeks. A process called induction therapy. So induction therapy will always be intravenous. After a while, they may switch over to pills which can be given orally. Medication can be injected into the eye if the vision is in danger. The following medicines may be prescribed: cidofovir, foscarnet, ganciclovir, maribavir, valgalcyclovir, of which we have foscarnet available in India and ganciclovir also available. These two drugs are given in as IV. Ganciclovir is given 5 milligram per kg body weight, 8th hourly initially, then 12th hourly for 3 to 4 weeks. Then foscarnet, initially we give it 60 milligram per kg body weight, 8th hourly, and 80 milligram 12th hourly, and 90 milligram per kg body weight per day. While valcyclovir, we give it orally after finishing ganciclovir or foscarnet through IV. We give it as 900 milligram uh, pills, 8th hourly initially, then 12th hourly we give, and we maintain it for a long time. These drugs generally can't cure the disease. If the patient have advanced HIV, but they can control it while the patient gets antiretroviral therapy. So, if the patient is not diagnosed as HIV and who is not on ART, it comes with signs and symptoms of cytomegalovirus, we have to do screening for HIV and start ART immediately before starting the cytomegalovirus infusion also, because only when we give ART, these patients with HIV will respond to cytomegalovirus treatment by other drugs. Depending on the medicine, patient could have side effects including low white blood cell count, neutropenia, which raises his or chance for other infections, feeling tired from low red cell count, anemia, neutropenia, anemia, upset stomach or throwing up, rash, kidney problems. Most important, if he or she takes ART early in an HIV infection, drug will keep it from getting worse and will keep him or her from getting cytomegalovirus. Because I told you, only when the CD4 count falls below 100, the cytomegalovirus becomes dominant and they manifest signs and symptoms. But when we diagnose before CD4 falls below 200 or 300 and start ART, bring it up, take it up to 400 or so, the chance of not only cytomegalovirus infection but other opportunity infections will also be curtailed when the patient is on early HIV treatment and on ART. The complications of cytomegalovirus are mononucleosis, Guillain-Barré syndrome, brain inflammation, that is encephalitis, heart inflammation, that is myocarditis. So patients rise of encephalitis and myocarditis. In people with HIV, complications include retinitis, pneumonia, skin rash and lesions, problems in the nerves, esophagus, lungs, colon or mucous membrane, brain swelling. Complication in babies born with cytomegalovirus include learning problems, cerebral palsy or trouble with muscle tone and coordination, seizure. So these are the complications in the congenital CMV. How to so prevention is better than cure. So when the cure is not there, complete cure is not there, it is better to prevent. CME was once the most common viral opportunity infections, illness that are worse or happen more often in people with weakened immune system and tied to HIV. Now ART can help to keep your CD4 count up and immune system strong. It can also help stop retinitis from coming back. If the patient have advanced HIV, doctor might also give medicines to prevent cytomegalovirus prophylactic dose in addition to ART. While ganciclovir orally we can give. But it is expensive, sometimes causes severe side effects and may not work well. So usually we withhold giving prophylactic dose for cytomegalovirus, where we give for other opportune infections like tuberculosis, like INH prophylaxis, or cryptosporidium using cotrimoxazole. Most important thing is to take ART medication daily as prescribed. So, this is in short about cytomegalovirus. To summarize, more than 50% of the males of the adults in states have. In African Asian countries, it can be up to 80% because we are seeing clinical cases of congenital cytomegalovirus. So, so it can be passed on from mother to fetus in the womb, or it can be acquired by exchange of body fluids, especially saliva and other body fluids. And if the HIV is there, it can reactivate the asymptomatic cytomegalovirus and cause it manifest and also cause the worst problem of CMV retinitis and also other complications leading to myocarditis, meningitis, pneumonitis, things, and even kidney affecting the kidney and ending the life of the patient. So it is better we screen people for HIV and keep on screening the CD4. When the count falls, we have to look for CMV infections. Give, if necessary, if they can afford, we can give prophylactic things. And once they have the disease, we give ganciclovir and foscarnet IV for 3 to 4 weeks and valganciclovir orally after that. We cannot cure, but we can control. And when we give ART with the CMV, we can reverse the CMV and prevent other opportune infections also. So, if there are any doubts, I am willing to answer.
Thank you so much, sir. Thank you. Even in spite of you not being well and having a sore throat, you tried to conduct this particular session. So, thank you so much for your spirit, sir, and for your dedication towards this. Thank you for that. We have received few questions, sir, from the participants. I'll put across those questions without giving much difficulty to your throat. The first question is from Dr. Renu. Dr. Renu wants to know any role maribavir benzimidazole antiviral agent as a potential option for salvage treatment.
Kindly repeat any antiviral.
Any role maribavir benzimidazole antiviral agent as a potential option for salvage treatment.
See, the CMV uh, is transferred by exchange of body fluids. So, simple kissing without exchange of saliva will not cause any problem. But sexual contact without condom will produce these CME infections. And to give prophylaxis for CMV is costly and there are side effects of the drugs like ganciclovir, foscarnet, and valganciclovir. But ART is safe, so we have to start. If the patient is HIV, we have to start. If the patient is not on HIV, if the IgG is positive, we have to see the patient at periodical intervals and whenever they have signs and symptoms, we have to screen them and do that. And
Thank you so much,
so,
sir, for answering this question. We will take up the next question that we have received, and the question is from Dr. Goyal. Dr. Goyal wants to know what is the rate of CMV infection in immunocompetent adults with critical illness.
you are asking about the incubation period in the CME. All infections they do have, but here we have to find out whether it is acquired cytomegalovirus infections or the reactivated cytomegalovirus infections. So when the patients indulges in unprotected sex or deep kissing with the exchange of body fluids. And when he starts developing fever, malaise, and other things, this is called the incubation period. This is usually 2 to 3 weeks or after the incidents. So once we rule out congenital or reactivation. If a person gets the fever, body pain, malaise, and other things within 2 or 3 weeks, he has to suspect cytomegalovirus infection and he has to take up the test. PCR will be the earliest positive things, then the ELISA.
Thank you so much, sir, for answering that question. We will take up the next question, and the question is rate of increase in the level of CMV load predictive of symptomatic disease?
Roma, well, can you be a little louder?
Yeah, the question is rate of increase in the level of CMV load predictive of symptomatic disease?
See, ma'am, had it been symptomatic in majority of the cases, it would have caused panic or epidemic or in the United States. Since they are asymptomatic and maintain a good immunity by good diet and other things, they they most of them are asymptomatic. Whereas in poor African countries where they do not have good food and good sanitation and other things, these people are bound to get the manifest uh, CME signs and symptoms. We, we have seen in many of the infant mortality or neonatal mortality is high in African countries because of CME infections and other things. And especially they do not have organ transplant and advanced organ transplant because once they put them on immunosuppressive drugs, they are bound to have CME reactivation and manifest the disease. So the it is more of a socio-economic problem in African countries where we have to improve the sanitation, hygiene, food, and other things, and give good Medicare things. Then only it will be able to control cytomegalovirus infections. In India, we are a developing country. We are underdeveloped in certain parts, developed in many parts. So we have both extremes there. But we have a good health system, especially the public health system. We have primary health centers and sub-centers reaching to nook and corner of the villages in India. So, and most of the people are trained, and as a paramedical people are trained, and whenever they don't low birth weight, premature delivery, they are referred to higher centers and taken care of. So, somewhat the picture is not that much panicky as in African countries.
Thank you so much, sir. Thank you for answering that question. We will take up the last question, and the last question is any role of CMV culture of stool specimens for the diagnosis of CMV colitis?
Good, and hello?
Yeah, yeah. Am I
Because
audible,
of the
sir?
cold, severe things, my ears are also blocked. Kindly
I'll
repeat
repeat the
what?
question, sir. I'll repeat the question, no problem. The question is there any role of CMV culture of stool specimens for the diagnosis of CMV colitis?
Yeah, collected. Yeah. See, I told you, almost all the parts of the body as will be affected, and when they have infection of the colon, and if you when we see the colonoscopy is not, looks normal, but the patient continues to manifest symptoms, then we have to think of this virus infection and screen it. And when we do colonoscopy, it is easy to get the specimen and send it for culture. But culture is not done routinely in many of the laboratories. They do only serological or the tissue biopsy. Sometimes it is that. So from the colon we can take a tissue biopsy apart from culture and send it, and good pathologists will be able to interpret the findings. So sometimes the gastroenterologists they start the treatment empirically also when these facilities are not available. As a last resort, they may start empirically also.
Thank you so much, sir. Thank you for answering all the questions. In spite of you not being well, you have taken up the questions very sportingly, sir. Thank you so much for that. And with this, we would like to thank all the participants for their ardent participation that they have shown throughout. And we would like to conclude the session here for today, sir, by not bothering you much because you are unwell today. So we won't take a lot of your time. And please do take care of yourself, sir, and be fit as soon as possible so that we can conduct the session again in near future as early as possible.
So, like Indigo, we have arrived before the scheduled timing of
Right,
arrival.
right, right. It's been for the first time,
So,
sir, that because of you not being well, it's been getting ended today, concluding earlier than the scheduled time.
so let me apologize for my bad throat, and due to that
No, no, no,
little
no, sir. You don't need to
hearing
apologize, but
impairment.
please do take care of your health and kindly be fit as earliest as possible. That is what we are
Tha-
praying for.
Thank you. Thank you.
Thank you so much, sir. With this, we are concluding the session here for today. Until next time.